It's very stressful. Every time I go into work, every time I see patients, I'm definitely thinking about it.
Dr. Dory Schiff rolled up her sleeve after signing a consent form saying she'd get a second dose in 21 days. She didn't. And she doesn't know when she'll get shot too. Quebec now getting all the vaccines out the door for first doses instead.
We consented to a 2-dose vaccine. We didn't consent to be given something that was off-label, and we didn't consent to be part of an experiment.
Citing breach of contract, a lawyer for families at this Montreal care home is taking action, writing the Quebec government in an effort to get the residents at Maimonides Geriatric Centre their second dose.
I would like to really strongly emphasize is that Canada is committed to a 2-dose vaccine regimen.
That is just one of several vaccine issues across the country. And while rollout is a provincial and territorial responsibility, it's the federal government that has to get them there, with some premiers saying that's not happening fast enough.
Canada has proven that we're ready for a sustained tempo of vaccine deliveries expected throughout the month of January.
We have seen some challenges.
He admits to challenges, but Prime Minister Justin Trudeau is confident all Canadians who want a vaccine can get one by the fall.
I think all Canadians, including me, are frustrated to see vaccines in freezers and not in people's arms. That's why we're going to continue working closely with the provinces.
Trudeau announced a meeting with all premiers Thursday. Rollout is on the agenda, but he didn't offer specifics of how Ottawa will help.
There are many other ways of doing it other than just through hospital centres.
Ontario greenlit a pilot project in Ottawa to get the Pfizer vaccine, which needs to be stored at ultra-cold temperatures inside long-term care homes, with the rollout at this one starting Tuesday, the first site in the province outside a hospital.
This will help save the lives of those who are most at risk. And one day soon, the vaccine will be available to anyone in Ottawa who wishes to receive it.
Here in Ottawa, second doses of the Pfizer vaccine are rolling out, while the Premier is promising anyone connected to long-term care in the hardest-hit regions of this province will be vaccinated by January 21st. Abigail Bimman, Global News, Ottawa.
All levels of government seem to agree vaccinations are a top priority in the fight against COVID-19. But right now, when compared to other countries, Canada is falling behind. Eric Sorensen looks at the numbers and what some provinces are doing to speed up the rollout.
Canada was ready with open arms to receive the first vaccines and to show off the first vaccinations. But rolling out a mass program is clearly a work in progress. Barely a third have been jabbed so far. Of the 420,000 doses sent to provinces and territories, just 148,000 have been administered. That represents fewer than 4 people per 1,000 Canadians. The U.S. and U.K. have vaccinated almost 14 per 1,000. Israel an astounding 158 per 1,000. Canada began receiving doses last month, and vaccinations began. But as more vaccines arrived, the challenge has been a growing gap between vaccines distributed and vaccines administered.
We clearly need to pick up the pace, and we need to pick up the pace rapidly. We know that these vaccines don't do any good in freezers. They have to be in arms.
Yes, did we hit a couple bumps in the road? I'm always first to admit. When there's bumps in the road, we get through them.
Ontario's premier says the biggest province is ironing out its distribution bumps in a hurry. The province expects from Pfizer-BioNTech tens of thousands of doses each week this month, plus thousands more from Moderna. And it now expects to exhaust the supply just as quickly.
Once we get this shipment in Thursday for Pfizer, we're going to run out of it again the following weekend. Folks, we're ramping up.
In Winnipeg, the Manitoba government has opened a super site to speed up vaccinations. And in Nova Scotia, there are plans for clinics across the province.
What we've learned now in the first few weeks will help us become more agile.
In a few months, when vaccines finally arrive in huge numbers, many of Canada's 11,000 pharmacies stand ready. The head of one says altogether they could vaccinate more than 2 million Canadians a week.
Our pharmacists are ready to do it. We have the processes in place, and we can handle this and are ready to step up and help.
As the pandemic surges, governments at all levels are urgently trying to get vaccines distributed efficiently across the country, so vulnerable populations, followed by all Canadians, can get their shots as soon as possible. Eric Sorensen, Global News, Toronto.